This is really likely to come up in your exams, and it's really often a 6 marker in paper 1. So you've got to know it really, really well. We're talking about how you can use different types of stem cells. So quick recap, different types of stem cells. We've got embryonic, adult, and meristem. We're going to go through all 3 today. So how do we use stem cells? Well, stem cells are undifferentiated. That means that they can specialize, they can differentiate to become other types of cells. So we could use them to grow and develop new tissues. Why would we want to grow new tissues? Well, the first example might be to treat diseases. For example, we could grow pancreatic tissue. This could be useful for treating something like type 1 diabetes, where someone's pancreas isn't functioning correctly and is not producing insulin. Another example of a treatment using these stem cells would be to grow new nerve tissue. This would be useful for treating patients that are paralyzed, perhaps, because of damage to their nerves. Another way that we might use stem cells, and this is a kind of very new area of research, we're not quite there yet medically, is growing new organs. Someone who perhaps has kidney failure, where their kidney is no longer functioning, it may be possible in the future to use stem cells to produce an entire new kidney. Now, coming back to those different types of stem cells, well, some of them have got advantages, some of them have got disadvantages. So adult stem cells. Well, the advantage of these adult stem cells is the fact that they're quite well tested. We've been using adult stem cells for quite a while medically. But the problem with adult stem cells is if they come from a different patient, if they come from a different person, then the body will recognize them as being foreign cells and so will reject those cells. It will trigger an immune response. So the patient, the person who's getting the transplant, they would have to take immunosuppressant drugs in order to suppress their immune system so that they don't reject that new organ. This would also be the same if we were using embryonic stem cells as well. Now, sometimes it's possible to take adult stem cells from the patient themselves, in which case there wouldn't be any issues with rejection. What about the risk associated with stem cells? Well, any sort of surgery, operation carries some risk associated with it. There is a risk of infection. Perhaps also the removal of those adult stem cells can be very, very painful as well, particularly if we're trying to extract something like bone marrow. We also have the complications around ethics and consent. Now, embryonic stem cells, the embryo cannot consent to the cells being used. And we also have the ethical issues around the fact that the embryo is destroyed. It's really